Hello, hello.
Hello.
Hello, Dr.
Hello.
Omer Farooq Khan. How are you?
I'm fine, sir. How are you?
Very good. It's good to see you. I've never seen you before. Are you ready to go?
Yeah, I am ready to go.
Now, let me ask, do you want to, as far as questions being asked, will you take questions during your presentation or do you want to wait until the end?
Uh, uh, I think till the end is better. But if you people prefer taking questions during the presentation or lecture as well, then I'm okay with that as well.
Well, we want an hour. So sometimes if you take questions during the presentation, there's not enough time to finish the presentation.
Yeah, it happens.
So we'll try to limit the questions during the presentation. But can you see the chat? Because you can actually look into the chat.
Okay. Yeah, I
And
can see the chat. Right now, I there is only one message from Clara Folk, and it was hello, and I responded hi. So there is a chat.
okay, because sometimes you can see questions in chat. If I see a really interesting question where someone needs to understand something, I'll stop and give you the question.
Okay, but taking questions like that doesn't it it disturbs the momentum or flow of the lecture or
Exactly,
presentation.
exactly. So yeah, I won't do
So,
that then. I'll just so at the beginning, I'll just tell everybody to wait until the end for their questions.
okay, okay.
So
Do I
you
need
should,
to introduce myself first to
yeah.
you, sir?
No,
Or
you'll
we
introduce
need to
yourself
do?
to the class, and that'll be my
Yeah.
introduction.
Okay. And can I know about you as well, if you don't mind?
I'm the academic director at AIU.
Okay. Okay.
So with my specialties are like in, I did my thesis work in economics, working on effective
Okay.
demand.
Thank
And
you.
other than that, I've studied almost everything from nutrition to medicine to thesis writing to psychology.
Because you are academic director and you have to oversee everything. So
Yes.
you have to look into everything, being
Yes.
academic
So I've
director.
traveled around
That's
the world and
wonderful.
studied many different things. And
That's wonderful to know.
I'm not like, I'm not, I don't have as much information as Chat GPT. That's for sure though.
But for me, you are Mr. Know-it-all, sir.
Chat GPT is Mr. Know-it-all. I go to Chat
Okay.
GPT.
Okay. Thank you.
Okay, let's go ahead and get everybody admitted. Here they, so you have your presentation ready to go?
Yeah, I have my presentation ready to go. I sent it to Miss Antonella.
Okay. It would actually be good to have those presentations available during, so because the students are always asking to upload to, if they can download your presentation to see it for themselves.
I have shared it with
Antonella.
yeah, yeah, I have shared it with Miss Antonella. And if she wants to share, it's open access. So I am giving every right, whoever wants to look at it. Or
Perfect.
can I share my screen?
Let me check. I have to check to see if you're a co-host. Yes, you can. So welcome everybody to another live class at AIU, Atlantic International University. With us today is Dr. Omer Farooq Khan, who is going to be talking about public health management.
Hello, everyone. My name is Dr. Omer Farooq Khan. I am resident surgeon doing my specialization in orthopedic surgery. And I am doing my residency or my specialty training in Benazir Bhutto Hospital. It is a tertiary care hospital in the city of Rawalpindi or Islamabad. These are twin cities basically. And my university is my university is Rawalpindi Medical University. So that is my introduction. And today our topic of discussion is a very vast topic, basically. So public health care management, we can call it with two names. Some people call it public health management, and some people call it healthcare management. So these are the same synonyms type of things. These are the same things. So basically, I will call it healthcare management or public healthcare management, or the way it's called public health management, whatever you want to call it. So the topic of our presentation today is a very vast topic. It cannot be covered in a single sitting. It cannot be covered in 1 hour, but we will try to go into initial details or basic details of the topic. Like, we will get to know what exactly is public health management or healthcare management. So I hope we are good to go.
We are good to go.
Can I start sharing my screen?
Yes.
Can I start sharing my screen?
Do you see the button down below to share screen?
Yeah, I have. I do see the button down below.
Public healthcare and healthcare is essential for a healthy population that can be productive and living a good life.
Yeah, it
So
is
this
very
is
important these days because the healthcare sector has. Can everybody see, sir? Can everybody see the presentation?
yes. Oh, I just wanted to say that hold off your questions until the end of the presentation. So make a note, make a note of your questions and then ask them at the end.
Yeah, because I think if there is some important question, you can ask the co-host about the question. If he seems that the question is very important, he may forward it to me. But first, let me start. Let me kick it off first, because the chat is right now booming. Okay, should we start now?
Yes, please go ahead.
Oh, so our topic for today is introduction to public healthcare management. I will call it healthcare management. Some people call it public health management. And in some parts of the world, they also call it healthcare administration. But these days, these two terms are being used in different meanings. In you can say in 1980s or 1990s, the two terms, public health management or healthcare administration, both were the same thing. But right now, they are considered two different things by many organizations. And many organizations have started to use these two terms in different meanings. So my today topic is public healthcare management. I gave you an introduction. So this occupation or profession is one of the fastest growing. In healthcare sector, this occupation or profession is one of the fastest growing. It due to expansion and diversification of the healthcare industry in recent 2 to 3 decades, the need for healthcare management or the management seats in healthcare sectors or organizations has grown dramatically. Previously, there was not this much diversity in healthcare sector. There was not this much, need for subspecialties or supra specialties. Like, I will give an example of my own field. Look, I am doing residency in FCPS orthopedic surgery. I am an orthopedic surgeon. So right now, there are at least 6 or 7 supra specialties in orthopedic surgery as well. So to look at the legal aspects of orthopedic surgery, to look at the procedural details of the orthopedic surgery, to look into the guidelines of the treatments of the orthopedic surgery, to look into the needs of the patients, to look into the departmental needs, look into the biomedical needs of the department. There are many high-tech equipments being used in different operation theaters. Talking about my field, orthopedic surgery is the only is one field which I'm talking about, and it has 6 or 7 more subspecialties available these days. So if we talk about healthcare sector overall, then the subspecialties or super specialties have increased dramatically. Previously, there was only one specialty called as internal medicine or medical specialists in 1980s or 1970s. They would used to treat every kind of patient. They would deal with endocrinology, they would deal with pulmonology, they will also be treating diabetic patients, they would also be treating the tuberculosis patients, and they were also dealing the derma patients and many other things. But right now there are dermatologists, there are endocrinologists, there are pulmonologists who deal with the chest diseases, there are endocrinologists who deal with the hormonal imbalances, there are sexologists, there are many kinds of subspecialties or super specialties that are present in only in medical field. So just like that, due to the advancement and diversification in the healthcare sector, management is needed. Management has its like we can say, management is mandatory now. The Bureau of Labor Statistics 2014 data projected that employment of medical and health services manager is expected to grow 23% from 2012 to 2022, faster than the average of all related occupation. And due to COVID problems, due to the problems with the COVID, you can say there was a bit break in this data. There was a bit, there was expected growth rate of 23%, but they could not achieve it. But I was reading in 2023, the growth in 2022 and 2023, the growth rates again went up to more than 23%, which is quite a remarkable growth rate. About to tell you people about the growth rate of this field is just to make you understand the future prospects. If somebody wants to go into the field of public healthcare management, then they can actually choose this field because this is a growing field. This is not a field where there is too much saturation. This is not a field where there are already too much people sitting at the top and they will not come you up, and there is a competition to go to the top. This is a field, still an open field. This is a developing field. So you can opt this as your profession, as your life choice. And this is a very rewarding profession, because if you are dealing with public health management, you make the lives of the people better. You make a good impact in the lives of the people. So due to well-paced advancements in healthcare sector, development of various allied health fields, just like I went into details of various allied health fields by giving two examples of medical specialties and my own field, orthopedic surgery, and highly qualified specialties and subspecialties, the need for managerial role has increased drastically. Today, we will talk about some of the things of the healthcare management. As I told previously, this is not something like you can say, this is not a topic which can be covered in a single sitting, but I will try to go to the initials. You can say, after this, able to understand that what public health management or what healthcare management is. So everyone should be able to understand at the end of this discussion, at the end of this session, what is healthcare management, what is its role, and a brief role. We will just touch what a healthcare manager is supposed to do. What a healthcare manager is supposed to do. We'll just briefly touch it. We will not go into details. We can't go into details because that is a topic for another day. But our today's learning objectives are definitions. First of all, we will try to understand what different terms mean. Importance of healthcare management, and healthcare administration. Look, I told you in the start of our discussion that these two terms, if you go back 2 to 3 decades, these two terms were used interchangeably. People will say he's an administrator or he's a manager, and they would mean to say that they both are same thing. But these days, these both roles are considered different by various organizations, and various organizations are still considering to opt that healthcare management is a separate thing and administrators are separate thing. I will tell you the details later. Various segments of healthcare industry, that is our fourth learning objective. Then our fifth learning objective is difference between healthcare sector and pharma sector. I hope everybody can listen and understand. Hello. Am I clear to everybody? Everybody can understand?
Yes.
Is there any problem in my voice? Is it
No.
clear?
Yeah, your voice is clear as far as I can hear. I don't see any comments
s-
in chat either that people are saying they can't hear
Okay,
you.
thank you, sir. Okay, thank you. Because I just want to say that I'm not a native in English, but because my schooling and my graduation and now my post-graduation all are being done in English. So I'm trying to be eloquent and as clear as possible.
Yeah,
I hope
sounds
I
great.
am.
Yeah,
Uh,
yeah,
uh,
doing a
okay,
wonderful job.
thank you, sir. Okay, thank you, sir. Thank you so much, sir. Okay, we were talking about our learning objectives for today's lecture. So 4 segments of healthcare industry, 5 difference between healthcare sector and pharma sector. That is a very important and very tricky thing as well, because these days, there are many scandals related to big pharma companies and many scandals related to medicines right now. And if you look at past 3 or 4 years, there are also many they used to take names of different companies that they were just making fortunes and things like that. So you have to understand what is pharma sector and what is healthcare sectors. You have to draw the line between the 2 sectors. I'm not saying any bad thing about pharma sectors. Maybe there are some pharma guys here listening. I'm not saying any bad thing about pharma sector. I'm just saying that you have to draw a line between healthcare sector and pharma sector. Okay, and our 6th learning objective is emerging role of healthcare management and its domains. So there are 2 domains. We'll dig deeper into what are the domains of healthcare management, but there are 2 domains, one external domain and one is internal domains. External domains are covered externally and internal domains are covered internally. We'll go deeper into that when we go into that part of our lecture or presentation. Then, what does healthcare management involve? It's 7 and 8 is actually same thing. It's like what a manager has to do. Who is a healthcare manager and what he has to do? So I hope we started. So first of all, we start to understand the ABC of healthcare management. And in order to start the ABC of healthcare management, you have to understand what is health. It is basics. I know many of you people do know about what is health, but if somebody doesn't know what is health, then you cannot go forward. So in order to go forward, you have to devise a systematic approach. And that systematic approach starts with basic definitions of what we are gonna talk about. If you're going to talk about healthcare, health is, then I think any topic. So we'll talk about health. Health is a state of complete physical, mental, and social well-being of a person, and not merely the absence of disease or infirmity. I will repeat it again. Health is a state of complete physical, mental, and social well-being of a person, and not merely the absence of disease or infirmity. If a physician or any patient checks any person and he deems that person physically fit, mentally fit, and socially fit. What is social well-being? Social well-being is your social behavior with the people of the society, as man is a social animal. So if somebody thinks that he is physically and mentally fit and he does not behave normally in social circumstances, when he's with people, he cannot behave normally, he cannot be called as a proper healthy person. So physical fitness, mental fitness, and social well-being of a person is mandatory in the definition of a health. And not merely the absence of disease or infirmity. Like if somebody says, I'm not diseased, or if some physicians look at looks at some patient's files or look at the patients and says, I do not find any kind of disease in that patient, still he has to prove that the patient is physically, mentally, and socially fit. Then that person is called healthy. Then healthcare. What is healthcare? Healthcare is organized provision. There are two definitions. One is the shorter one and one is the longer one. First, we will cover the shorter one for better understanding. What is healthcare? Organized provision of medical care to individuals or community. Organized. This is Oxford definition basically. So Oxford people try to define healthcare in this way. Organized provision. Look, every word has its meaning. I will go. What is organized provision? What is organization? We will go into that as well. Organized provision of medical care to individuals or a community, or the improvement of health of the community via the prevention, diagnosis, treatment, and cure of disease, illness, injury, and other physical and mental impairment in people through an organized, again, that word, organized, through an organized way using health professionals and allied health fields. The improvement of health via the prevention, it is a longer definition, so I will repeat it again. The improvement of health via the prevention, diagnosis, treatment, and cure of disease, illness, injury, and other physical and mental impairment in people through an organized way using health professionals and allied health fields. That is healthcare. Definitions continue. As I told you, I will not go into the details of the topic without making you understand the ABC of what we are going to talk about. So first we will come to know what we are going to talk about. The terms which I am going to use again and again. First, you should be familiar with those terms. Then we will start understanding the next concepts related with those terms. What is an organization? We will use this term again and again in our lecture. Healthcare organizations, healthcare organizations, healthcare organizations. So what is an organization? Organization refers to a collection of people who are working together in a systematic way, okay? Who are working together, systematic way, not haphazardly. There is a system in which an organization works, and that system has to be predefined and predetermined. So organization refers to a collection of a people. You can say group of people, whatever synonym you want to use. Organization refers to collection of people who are working together. That is again an important thing. Who are working together in a systematic way to achieve a predetermined common goal. That is again important. Predetermined common goal or objective, which can be achieved by any person working alone. Organized together in a systematic way to achieve a predetermined achieved by any person working alone. So that is an organization. If any person says, I can do everything alone, I will run an organization alone, that is not possible. Because organization is what collection of people can do, not a single person can do. There is a system, predetermined system. There is a predetermined common goal or objective, and there is a collection of people. There is a group of people which are willing to achieve that common goal or objective by working together. That is an organization. Now you can look at any kind of organization. That definition will fit right into the perspective of that organization. No organization will be working without people working together. No organization will be working without people working in a systematic way, not haphazardly. Someone has his face there and someone has his face there, and they both are trying to move in the same direction. Can they move? No, they can't. So there is a system. People have to work together, and there has to be a common predetermined goal of what that organization has to achieve. Then we can go into what the basis of our topic is: management. What is management? Management it has been defined as a process comprised of social and technical functions and activities occurring within an organization for the purpose of accomplishing predetermined of the term other resources because of the recent advancement computers being used for management purposes. So there is no ways to manage things as well, because right now these days there is remote management of many things going on, and that is only done with online data management and things like that. So you cannot only say that human, you have to say other resources as well. So it has been defined as a comprised of social and technical functions and activities of accomplishing predetermined to track the time as well, because I cannot prolong every slide. We have to complete everything within 45 or 50 minutes so that I can take questions, because I know there might be plenty of questions, because this is a topic which is a growing topic. This is a field which is a growing field. So many people would want to know if they can pursue this field in their future careers or not. So healthcare management. uh, Hold on, these are only the last two definitions, so don't worry, definitions are not going to go ahead of this. But everything has to be learned before we go into the details of these terms. If you keep using these terms without knowing these terms, then that is not fair, I think. Healthcare management, it is the profession or the field that provides leadership and direction to organizations we discussed previously, to organizations that deliver personal health services to public, and to divisions, departments, or units serving within those organizations. So what is healthcare management? I will repeat it again, because that is our topic. Public health management or healthcare management, both are the terms used interchangeably. I prefer to use the term healthcare management, but whatever you call it, public health management, or healthcare management, same things. It is a profession or the field that provides leadership and direction to organizations that deliver personal health services to public and to divisions, departments, or units serving within the organization. So not just organization as a whole, but to departments or divisions working within those organizations as well. Just like any senior manager or a director sitting at the top of the organization, although he has many people in the managerial roles, directly supervising many divisions, departments, or units. For example, there is a vast healthcare organization. You can say, just for an instance, Mayo Clinic. So there might be a director or CEO or any senior manager sitting at the top, and then there are departmental managers, or there are some divisions or units assigned to junior managers, and they are overseeing those departments or units. But after all of these have to be supervised. All of these have to answer to one person who has the authority, and that is the senior manager or director or CEO of that organization, who is sitting at the top. He has to look at every division, every department, and every unit serving within that organization, and then organization as a whole. So there is healthcare management. Now, who is the manager? Because whenever we talk about healthcare management, next thing is healthcare manager. The Whenever we go into details of these things, the last point of our discussion will be the role of healthcare manager. So who is the manager? Manager is the person who works with and through other people, who works with and through other people, carrying out technical and interpersonal activities to achieve the desired objective of the organization he's working for. So manager is the person who works with or and through other people, carrying out technical and interpersonal activities to achieve the desired objectives of the organization he's working for. Or manager is the person in the organization who supports and is responsible for the work performance of one or more other person. So he supports people, who are working under him or who are working with him, and is responsible for the work performance of one or more other persons who are working under him. So if there is an issue in any unit, any division, or any department, the CEO will not directly talk to that person. He will call up the manager that what is going on in that department, in that unit, in that division, who is being overseen by you. What is going on? I have received this complaint. You have to do inquiry upon, you have to do your inquiry, and then you will answer me. Because definitely, if there is a vast organization comprising of 1,500 people or 2,000 people, one CEO or one senior manager or one director of that organization cannot oversee or meet or do inquiry or you overlook the staff of whole organization single-handedly. You have to divide that work. So the junior managers or the persons overseeing those units or departments, they have to then provide him with the details that he wants. So manager is a person in the organization who supports and is responsible for the work performance of one or more other person. And that is a vast term. It's not just a term used for a healthcare manager. Any manager in any organization, whether it is a legal firm, whether it is a AI company, whether it is a car company or any automobile manufacturing or any other sector, telecommunication sector or IT sector, whatever you call it. So manager's role will remain same. Now we come to know our second learning objective, and that is importance of healthcare management. As we have come to know about the definitions of every single terminology that we are going to use in this lecture, and I have gone into super details of everything, so I will not repeat those things again and again. We will just go deeper. Importance of healthcare management. As healthcare sector deals with ailing humanity and provides life-saving goods and services, therefore effective management and good leadership are vital for this sector. All of the sectors are important. All of the sectors are super important. But whenever you are dealing with human lives, whenever you are dealing with diseased human beings, whenever you are dealing with ailing humanity, then that sector becomes even more important than other super important sectors, because you are dealing with human lives. You are dealing with emotional well-being of the people. You are dealing with the sufferings of the people. So if you are dealing with the sufferings of the people, then that sector shouldn't be broken. That sector shouldn't be overlooked. That sector shouldn't be underfunded. That sector needs proper management. That sector is very important. That sector is very, very important, because that sector is the sector, that system is the system which is directly dealing with human lives. Your one single mistake can cost somebody his or her life. Some parents may lose their children because of simple dehydration. And if simple dehydration case is missed by a pediatrician, then that is a catastrophe. So if there is proper management in diagnosing every single case, there is proper management that nobody, goes, if somebody comes into any organization, any healthcare organization, and his treatment is not done right, then that thing needs to be changed. Somebody has to oversee that what went wrong. So in this sector, management becomes even more important, because we are dealing with human lives. So importance of healthcare management becomes even more important. Importance of healthcare management is very, very pivotal to understand that if you overlook this sector, people start losing their lives. So you have to give due importance to this sector. Healthcare sector provides services and products which reduce sufferings of the people, treat illnesses, and potentially save their lives. Thus, effective leadership becomes even more necessary for ensuring that every task is done correctly and that everyone stays safe and healthy. You need proper leadership. You need proper management. You need a good leader sitting at the top who is sympathetic, who understands the needs of the community he's dealing with, who understand the common diseases in that community where healthcare organization is present. For example, if healthcare organization is present in some underdeveloped country and there are many cholera cases in that sector, or many infantile diarrhea or childhood diarrhea cases are being reported in that vicinity of the organization, then that organization has to be ready for such cases. If that organization is not ready for treating dehydration in children, then that organization is not working properly. And who will oversee all of these things? The managers, the administrators. These people will ensure that there is proper medication, proper IV fluids, proper IV lines, proper staff. The staff should be prepared for any kind of outbreaks, any kind of cholera outbreaks, any kind of problems with gastrointestinal system of the babies or even adults. So they should be prepared. And who has to oversee all of these things? Healthcare management. So the management has to see all of these things. So healthcare management becomes very important in such circumstances. Now, the difference between healthcare management and healthcare administration, we talked in the start. So these two terms were used interchangeably previously, as I told, but right now many organizations have started to have started to use these two terms in different meanings. So there are now two terms. These two terms are used separately these days. One is jobs of healthcare manager, and the other is jobs of healthcare administration. So what are the jobs of healthcare manager that we will not count into the jobs of healthcare administrator? So jobs of healthcare manager include managers are in charge of entire organization. So basically senior management roles are being given to healthcare managers and not administrators. So managers are in charge of entire organization. They have to develop various plans and strategies. They have to develop future plans of the organization. We have to develop different strategies of engaging the general public so that general public starts trusting that healthcare organization. They start mentioning that healthcare organization, so that healthcare organization becomes a thriving healthcare organization, and it increases its patient care programs, it adds its facilities and things like that. So a manager keeps on developing plans and strategies for betterment of that healthcare organization which he's working for. He has to maintain a relationship with various stakeholders. He has to develop relationships and maintain relationships with government agencies. They have to maintain. He have to maintain. Has to maintain relationship with the pharmaceutical companies, biotechnology companies, and biomedical equipment companies. So he has to meet community leaders. He have to lead with the political he have to meet and greet the political leaders of that community. What do they want? What do they want a new thing for the society? If they want some addition, service addition, for example, if there is an organization and that organization is working without a proper trauma room or without proper orthopedic surgery setup, and some community leaders come up to healthcare manager that in these vicinities there is no orthopedic surgery setup. So if somebody breaks his leg, somebody breaks his arms, he has to travel 50 kilometers away, he has to travel 100 kilometers away to get basic treatment for his leg fracture. So why not you add an orthopedic department in this healthcare organization which is working in our community? So that healthcare manager has to look into it, and healthcare manager has to add that service into that organization so that community needs are fulfilled. And he has to meet those stakeholders. He has to meet political leaders. He has to meet community leaders. So all of these stakeholders will keep on giving their input, and then healthcare manager will decide what is good or what is bad for our organization. managing service deliveries and value addition in healthcare facilities. So he has to manage service deliveries. He has to get a proper feedback that whether our service delivery is good or bad. He has to deal with finance and budgetary. He has to deal with finance. He has to deal with budgetary. He should not cross his budget limits. So if there is an organization, and that organization, for example, that organization has to work within a cap of $2 million per annum. So he has to manage all of the expenses of that healthcare organization within 2 million. So he has to manage it, and that is the job. If he takes help of an accountant, so be it. If he takes help of some commerce guy, so be it, but he has to do it. He has to remain within the confinements of approved budgets. There are things like he has to define targets and attend various meetings. So basically various meetings, it has to, just like I've said, maintain a relationship with various stakeholders. So if he has to maintain a relationship with various stakeholders, so he has to attend meetings with those stakeholders. So what is the job of healthcare administrator? We talked in detail about the job of healthcare manager. Now we'll go deep into the healthcare administration. So administrators are basically the first and most important thing these days. Many organizations, they have limited the administrative roles to the predefined departmental or division levels. So they do not oversee the entire organization. They see the problems with the staff. So they are basically staff managers and personal level managers. They also deal with the departments, but not with entire organization. So if healthcare administrator, if you look at any healthcare administrator, and if that term is being used in different meanings by that organization, then that healthcare administrator will be looking at personal level management of the staff. He will be looking at the rosters of the staff. He will be looking at the duties of the staff, when to send that person, for example, when to send person A on leaves, when to give the leaves to person B, and when to cancel the leave, when to cancel the leaves of person C. If person A is working properly, if person B is working properly, if person C is working properly, these kind of things, the staff level management or personal level management are done by healthcare administration. So they directly manage staff. Developing department specific objectives. Now, what are the department specific objectives, and what is the difference between organization specific objectives? So I will again give an example. So there is a department of general surgery in any organization, and that general surgery department needs a new advanced operation theater. Now that is the job of that healthcare administrator overlooking that general surgery department, to uh, provide that department that demand in written form through proper channel to their healthcare manager, so that healthcare manager then gets its approval. So if a general surgery setup needs a new operation theater, a new operating setup instead of an old one, they will inform their healthcare administrator in written form, and that healthcare administrator will write their demands in written form for that department, because he's overlooking that department. So he will write that need of the operation theater, and he will then convey that need through proper channel to their manager or to their CEO or director, whoever the senior person is. Then keeping and organizing records of staff files and services. So he has to overlook all the clerical data of the staff and services. He has to oversee all of the logbooks. He has to oversee all of the medical stores data, so that he has to look that what kind of medicine is present in our healthcare stores, if there is any medicine near expiry in our health stores, in our pharma stores, so in our medical equipment stores. So he has to look at all of these things, and he has to make sure that nobody lags behind in those things. He has to be updated about these things, and he has to keep himself or herself updated, so that uh, kind of so that all of these things remain within confines of that administrator. And he also ensures regulatory compliance. What is regulatory compliance? It's just like that. If any department or any body of government body wants something to be done in a special kind of law, then he has to overlook that whether we are compliant to those regulations or not. Then there are segments of healthcare industry. We will not go into details because that is not something very important. So there are healthcare providers which are direct care settings. There are hospitals, clinic, and other healthcare setups, whether public or private. Then there are nursing homes and other rehabilitative centers. Then there are ambulatory service providers. Then there is another segment of health service industry, that is healthcare budgeters. And healthcare budgeters involve two types of things. One is insurance companies and other is government agencies. Some in some countries, all of the healthcare system is insurance based. So insurance companies, for most part of it, insurance companies oversee all of the budgetary of the healthcare system. And in some parts of the world, just like in Pakistan, only in public hospitals, government funding is done in all of the public hospitals. I'm not talking about private hospitals. Public hospitals, government funding is done, and only government agencies provide healthcare coverage to the public. Then there are life sciences, which are indirect care settings. So they are not directly related with the patient. They're not direct care settings, but they are indirectly related with the patient, because they are also making products which will impact the lives of the patients, which are being treated by healthcare sector, by doctors or nurses or paramedics. Pharmaceutical companies that manufacture medicines and other biomedical products, biomedical equipment manufacturers who make high-tech medical and surgical devices, biotechnology companies that conduct drug research. Then there is a difference between healthcare sector and pharma sector. So there is a line that has to be drawn between what is healthcare sector and pharma sector. So healthcare sector, it involves, as we already know, I have gone into details of all of these things. So I will just discuss briefly here. Healthcare sector involves hospitals and clinics, medical research and clinical trials, telemedicine, health tourism, medical insurance, and medical equipment and technologies. These are all of the things which come into the domains of healthcare sector. And what is pharma sector? Pharma sector includes pharmaceuticals, medicines, and biochemical products produced by those pharmaceutical companies. Their production, their distribution, and regulation is done by pharma industry. So pharma sector, it involves pharmaceuticals, medicines, and biochemical products, and then their production, distribution, and regulation. All of this is done by pharma industry. I will give you a brief example of difference between healthcare sector and pharma sector. For example, if you are a patient and you go to a hospital or a clinic for some kind of problem, if you are having a rash on your skin, just for an instance, if you are having a rash on your skin and you go to a hospital, you get to a doctor, a dermatologist in that hospital. The dermatologist does your checkup. The dermatologist, he or she does your checkup, and he or she treats you and guides you about certain things or certain allergic things that maybe you may be allergic to this or that, and then prescribes you some medication. That is under the domains of healthcare sector. You went to a hospital, you went to a doctor, you got yourself checked up, you got your prescription. You are under the domains of healthcare setup. You get that prescription and you go to a chemist, you go to a pharmacist or a chemist. That thing then goes into pharma sector. You go to a chemist, he got that medicine which is prescribed from a wholesaler got that from a regional distributor, and regional distributor gets those things from manufacturers, just like Sanofi or Pfizer or Abbott or many big companies who are manufacturers of the pharma things. So whenever you go with your prescription to a chemist, you enter the domains of pharmaceutical sector, from healthcare sector to pharmaceutical sector. So that is the basic difference. So we have to go towards what is the role of healthcare management in modern day health industry and its domain. So So healthcare management has become essential for smooth and efficient service delivery in the healthcare sector in this era. You know, from the past 2 or 3 decades, as the healthcare sector became vast, diversified, and divided into many subspecialties and super specialties, and many high-tech surgeries being performed, and high-tech procedures being performed, and high-end things being done. So the management has to be increased as well. The managerial roles have to be increased as well. So healthcare management has become essential for smooth and efficient service delivery in healthcare sector in this era. Following are some of the examples of how healthcare managers play a pivotal role in modern day health sector. They plan, they direct, and they coordinate various activities in healthcare sector. Just like I told previously, budgeting and financial management of the entire healthcare organization, just and rationalize work schedules for all of the staff, so that neither person A is extremely relieved from the job, and neither person B is extremely overburdenized. So he has to look at all of the work schedules, all of the rotas, all of the rosters of the staff, that there is a just and rationalized work schedule for all of the staff. Nobody's overburdenized and nobody's underburdenized as well. Nobody's underperforming as well. So the role of healthcare management also continues. We have to we have to go into the planning and organizing the demand for workforce and directing job interviews for hiring new staff. All of these things have to be done by healthcare management managers. So planning and directing the demand for workforce, and directing job interviews for hiring new staff, all of these things have to be planned and organized by healthcare managers. Then there has to be supervisory role of the healthcare manager, or all of the departments working in an organization. Then maintain patient satisfaction through formation of an elaborate feedback system for all service delivery areas. So if a patient comes to the organization of any sector or any area, and the job of that healthcare manager overlooking that organization is to look at the feedback of the patients being treated at his or her organization thoroughly, so that if there is positive feedback, okay, he should commend the efforts of his staff, and he should encourage his staff to do or to perform better. But if there is negative feedback coming again and again from various sectors of the community, then healthcare manager has to overlook at the issues. He has to look at what is wrong with the staff or service delivery that people are complaining about. He has to look at all of these things. Then the most important thing, regulatory compliance and liaison with stakeholders. He has to comply by the rules of that country where the organization is present. He cannot sit in America and say, I will follow the rules of Europe. Or he cannot sit here in my country like Pakistan and he say, I will follow the rules of America. No, it's not like that. He or she has to ensure regulatory compliance of that country or a state where organization is situated, and then liaison with stakeholders. I already covered in detail. Then I talked about domains of healthcare previously. There are two domains of healthcare. One is external domain and one is internal domain. External domains include whatever is happening outside the organization. So whatever has to be done outside the organization by the manager, these are the external domains, like community or demographics needs. So he has to send people to the community for interviews, or for he has to meet local community leaders, so that what service delivery should be added in this healthcare organization so that community needs are fulfilled. He has to keep updated with the licensure of the organization. There are many medical licensing organizations in various countries, and you have to get a medical license for your organization so that your organization can keep functioning. You have to get accreditation of different healthcare councils and things like that. You have to abide by all the regulations. You have to fulfill the demands of all the stakeholders. I already told who are the stakeholders previously. He has to look keep a sharp look at the market competitors. If an organization is performing better than the organization of that manager, then he has to look at the aspects of why they are winning from my organization. So he has to keep a sharp look on competitors as well, market competitors. So he has to look at Medicare and Medicaid, managed care organization and insurers. He has to keep a sharp look at insurance companies, so that the insurance companies do not bother the patients when they need their healthcare insurance. Now, there are some internal things, just like we told, staffing, budgeting of different departments, and fulfilling the departmental needs of the organization. So various departments need different budgeting. So he or she has to allocate various funds for all of the departments. Then quality services improvements, patient satisfaction, just like we talked, physician relationships, physician relations with each other, so that there is no bickering, there is no professional jealousy within the organization. There is a healthy environment between senior and junior physicians, and between all of the senior physicians as well. There is no professional jealousy. So managers have to look at these aspects as well, that people are not fighting within the organization, because if people start fighting within the organizations fall apart. Then financial performance of the organization, so that whether any service delivery is commercially viable and fulfilling the needs of the community or not. Then technology acquisition, he has to acquire fresh technologies. He has to acquire fresh technologies, that whether that technology can fit in his or her organization as well. New service development, new service addition. So these are all the domain.
Dr. Omer, there you have 5
Yeah,
more
yeah.
minutes. You have 5 more
Yeah,
minutes
yeah,
for
yeah.
the hour.
Okay, okay.
Are you going to have time to take questions?
Yeah, because I am taking more time. Yeah. So it is my obligation to take questions. It's okay. No need to
Okay,
no problem at all.
we will have to limit the questions though for the time.
Okay. Okay. I think I have gone into all of the details, and the things which are coming ahead. All of these things will be covered shortly. Thank you, sir. Thank you for reminding me.
Okay, we have questions ready to go. Are you ready for the questions?
Can I just finish, because there are only 2 or 3 things remaining?
Okay, I think you'll have
Just
about
2 or 3 slides.
I think you'll
2
have
or 3 slides.
I think we have about all in all about a
5
little
minutes.
less than 20 minutes to finish the
Okay.
presentation and the
Okay.
questions.
Okay. No problem at all. I will just take 3 or 4 minutes, or maybe 5 minutes to conclude my topic. Then we will take questions for a whole of 15 minutes. Okay.
Okay, perfect.
Okay. So who are where were we? Okay. I didn't escape. No, I didn't escape. So the last learning objective of our today's topic is understanding the role of healthcare managers in healthcare management. So who are healthcare managers? I was reading this book, and there was this paragraph. So I just took a snap of that paragraph, because I liked it so much, because I wanted to convey it just the way it is written. So I took a snap and just I added that snap in. It is a textbook on healthcare management. So there is a general misconception regarding understanding the concept of managerial roles in healthcare settings, and this needs to change. I will just read the transcript just like it is written, because it is very beautifully written. While most beginning students of healthcare management tend to focus on the role of senior managers or lead administrator of an organization, it should be realized that management occurs through many others who may not have manager in their position title. Example of some of these managerial positions in healthcare organizations include supervisor or coordinator, director, among others. These levels of managerial roles are discussed in more details in the next table. So if there is not, the management does not include only a person sitting at the top. If a person is overlooking a staff of 10 people, he's or she is also manager. Managerial positions, these are just examples. I will just run through these examples. There is no time to waste on things. So for example, if there is a physician practice, he's a very good physician and he's practicing physician, then there is a practice manager. There is a director of medical records of all the patients related with that physician. They're working at the clinic of that physician. Then there is a supervisor or billing office. Same if there is a nursing home, what kind of managerial roles are at the nursing home? There is an administrator, there is a manager, there is a business office manager, there is a director, there is a food services manager for the nursing home independence. Then there is admissions coordinator, that if that person needs nursing home care or not, that has to be coordinated by some admissions coordinator. Then there is your overall supervisor, then there is environmental services. So all of these things, these are managerial roles within a nursing home. Then there is a hospital. Hospitals are chief executive or overlooked by chief executive officers, vice presidents, marketing managers, nursing managers, directors, revenue management, supervisor, or maintenance. So all of these are managerial positions. So it's not like just like I was only talking about a CEO or a director only. There are many managerial roles which can be. So if a person enters the management, a healthcare management sector, he cannot become CEO on the day one. He has to gain experience for like 10 years or 15 years to become a CEO of that organization, but he'll start by something. So these are all things where you can start. Now our last slide. 6 must have qualities to become a good manager. The manager should be a good planner. He should be a good organizer. He should be good at staffing, hiring and firing of the staff. That person A, whether he is needed, whether he is good for our management, our organization or not, whether person B is good for our organization or not, hiring and firing of the staff. A good person, a merit-based hiring system is being maintained or not in any organization, that has to be overlooked by a manager. If there is a merit-based system, organization works smoothly. Then controlling, he should be controlling. He should have control over his staff. He should have good directing quality, and he should be, or she should be, a good decision maker. If he or she is a good decision maker, then the organization will thrive. Okay, now questions, please.
Okay, we will start with a question from Obin Valeri B.
Okay, Obin Valeri. Can I see his
Thank you so
question, sir? Okay, he's talking in audio form. Okay, good. Go ahead.
so much, Dr. Farooq, for the wonderful presentation.
Thank
really
you,
appreciate
thank you,
so
sir.
much was gathered from your presentation.
I hope you understand. I hope you understood everything.
Sure, that is why I'm coming up with questions. Because, yeah, just that I have some conflicting ideas, because at the start of your presentation, you talked about the interchangeable use of public health manager and healthcare manager. But in the course of your presentation, I've actually discerned that the role of public healthcare manager, which is, if I can summarize it into 3 out of the many that you listed, we talk of planning, direction, and then there is budget and financing, and the one of the regulatory compliance, which is very important. Now, but when I look at the public health, which is purely centered on the patient level services, which means improvement of patient care in the hospital, which could be in or out of the hospital setting. Yes.
Your voice is being cut.
Just go to the end so that you can understand me. Hello?
Hello? Your voice just dropped. Yeah, just go to your question. Yeah, go to your question, because there are many people who want to question.
Perfect. So I was saying that now I get a little bit confused with the concept of the public health, which is principally centered on the patient level services, whereas the healthcare management, if I look vividly, is talking much about the aspect of budgeting and financial management, which goes to the industry structure.
No. Okay. Very good question. Very good question.
From your presentation, yes. Okay. Then the next point is that in respect to the aspect of regulatory compliance, I was thinking that maybe public health, since it's concerned with patient level services, they make proposals, and then the manager is supposed to check into the compliance, especially if it comes to the setting of projects, like we talk of the organizations. And then the last question is, based on your knowledge and maybe competence in that domain of healthcare management, what would you advise?
Okay.
In the case of a hospital setting, a healthcare administrator, a healthcare manager, or a public health manager, because if I look at it in a context in Africa, we have a serious problem when it comes to the aspect of management of our hospital settings. At times, we have people that are graduated from school, like maybe a medical doctor who becomes the director of the hospital. And now in this case, there is a conflict of
It's
position
just
in
like
terms
that.
of management. So
It's
what would
just
be your
like that.
advice?
It's just like that. So
Thank you.
first
Thank
I
you
will
so much.
you had 3 questions.
Yes.
I will just touch briefly. I will not go into details because there are many people. So a healthcare manager has to overlook all of these things. So it's not just like he has to overlook direct care of the patients. He has to overlook direct care of the patients indirectly. He's not the one who is treating those patients. He is the one who is overlooking the staff who is treating those patients. So there is public health being managed by a healthcare manager, but healthcare manager is not only looking at the staff who is treating the patients. He has to overlook at the broader aspects of the organizational needs as well. He has to overlook at the budgeting and financing as well. He has to overlook at the regulatory compliance as well, licensure as well. So if there is a CEO, he has to overlook all of these aspects, but he's not doing it alone. There is a team of people. There are accountants who are looking at budgeting and financing. There are legal people, there are law representatives who are looking at regulatory compliance and licensure. All of these things are being done by their respective specialty people. But then CEO is in the end, you can say, responsible for looking all of these things. So public health is being dealt by that organization, by public health staff, which is being overlooked by that healthcare manager. So that is how healthcare manager becomes an indirect caregiver. And the second part of you, I think I answer your 2 questions. And the third part of your question was, maybe you can repeat your question, your third question. Okay, I remember it. You need not repeat it. I remember it, that you are talking about there should be a doctor in African countries. There should be a doctor who has to become a director or a manager of any healthcare organization. It's just like that in Pakistan as well. You have to be a doctor first. Then you have to do another managerial course, another management course in public health management or hospital management, different names. Some universities call it hospital management course. Some people call it healthcare organization management course. Some people call it a healthcare management course. So you have to be a doctor first, because if you are not even a doctor, how can you understand about the needs of different patients and the needs of different diseases? You have to understand all of the diseases, all of the backgrounds of the diseases. Then you can talk to the doctors about the complaints of the patient. So you have to be a doctor first in all of the in almost 3/4 of the world. It is like that. You have to become a doctor first, and when you become a doctor, then you do another post-graduation level course in public health management, healthcare management, hospital management, whatever different universities in the world call it. Then you start from junior roles, from you start your career from some junior managerial role, and you gain your experience by working in an organization, and then you go above the step ladder. I hope I answered your question. Next question, please.
Next question is from CC Jules Haba.
Okay, CC Jules, go ahead.
Okay, thank you very much. Okay,
Thank you, sir.
I already sent my question on the chat box, which is as IT manager in Work Bank project in Guinea Conakry, West Africa. I need to know parallel to my IT task a knowledge on public health management to comply the context of the project to my IT job in terms of developing health-related solution, in terms of developing and deploying health data collection tool like Kobo Toolbox. I used to implement for 6 years now. I'm working in project. I need your advices in healthcare IT solution and how to manage my health IT solution to comply with the project healthcare objective for population. Thank you.
So pardon me, what do you want me to advise you? Exactly that part you need advice
in terms of health management and how to comply my IT solution with the health management project and with the project health management, how to get the good solution. I mean, the good solution,
Okay,
IT
from
solution,
what I because
IT solution,
okay.
like data collection, health data collection, and so on.
Yeah, yeah.
But to comply
Yeah.
with the
Okay.
management,
Okay.
management.
So
So I need your advice.
I am sorry, sir. I'm not an IT guy, but I hope I understand your thing, because
Okay.
there are many terms which you used from your IT language, which I was unable to comprehend properly. So I'm sorry if I did not understand everything related to what you talked about IT, but what you are talking about health management, that I will cover. So if you want to pursue your career regarding giving IT services to public healthcare organizations, I hope you want to talk about that, whether you can pursue it or not, and whether how you maybe you also want to talk about how in better way how can you do it. Maybe you want to talk about that, in which
Yes,
better way
yes.
you can do it.
Of course.
I think
Of
you want
course.
to talk
Of course.
about that.
Yeah,
So
yeah.
that is I hope thank God I got it. Thank God I got it, because I'm not an IT guy. I have been a doctor all my life. Okay, so the thing is, there are many things related with public health which overlap with the IT. Uh, Hospital management and information systems. These are the softwares. This is a basic name for any software. Hospital management and information systems, we call it HMIS in our country, in Pakistan. So these are the all of the softwares which are developed by IT people, and those IT people do it in a better way, who have a good grasp on who have good grasp on public health field. So if you want to do an IT job related with healthcare organization, definitely you have to understand the structures of the organization and what are their needs. For example, if some healthcare manager wants to devise a software for sending labs of the patient, then retrieving results of those labs, then maintaining records of all of the labs of one patient, registered with the case number of that patient. Registered with the case number of that patient. A
Yeah.
doctor or healthcare manager is not an IT guy. Definitely, he will ask some IT related person to do this for them. If IT related person knows what is a patient, what is the lab investigation, what is the name of lab investigation, what is the time of that lab investigation. For example, if we send a blood test and it takes 3 days, then that IT person should also know that he has to give a time window in that software for 3 days of that lab, so that the physician or the patient who are waiting for that lab, they should know that this lab result will return within 3 days. So an IT guy can pursue their career in public healthcare management. It is also an indirect care. It is not direct care. You are not the attending physician, but you are also providing care, because you have devised a tool that is helping that physician treat the person. So definitely you can go into that field, but you have to understand the basics of health field as well. Like if you want to devise a software, definitely you have to understand that that software uh, need some background knowledge about the public health field. I hope I answered your question. Time is short and we cannot take questions.
Thank you. I appreciate your answer. Thank you.
Yeah, I think
I
that's
hope
all
you
the
like
time we have. The only time we have left is for you to share your email. And if you can upload your presentation into chat for everybody, are you able to do that?
I can upload my presentation. Look, wait.
I'm asking the administration of the live classes to actually make the presentation
Maybe
available before the class.
I haven't done it before, so I think I will need to look into it whether I can upload it into the chat as well. But I have made it available to Miss Antonella.
If you look at like where you write the chat, if you look down below, there's an icon that says file. If you hover over it with your mouse, it says file, and then you can upload the presentation.
I know I know how to find the
Otherwise,
icon of the file, but I can't find it in my chat.
Then everybody you're going to have to wait 2 days for the presentation to be available in your student sections.
Within 2 days the presentation will be available, because I have shared it with the management.
Dr. Omer Farooq, do you want to give your email so that anybody who has questions still can like write to you and ask you those questions by email?
Okay, I can type my email here.
And then make
But
sure
you have
that
to behave. You have to behave professionally, and you have
Oh,
to
yeah.
talk about the things related with healthcare management, because definitely I will not be able to talk about any other field.
Yeah, so as you write your assignments for this course, use the emails as a good way to ask questions to answer the questions that you're going to write about in your assignments.
Yeah, I will try to answer the questions. Yeah, but she's not in the meeting. Okay, I can send it directly to everyone in meeting. I'm sending it.
Yeah, there was one student in here that says they needed the presentation for their organization because they were teaching something, and you had some great information available that they could use to teach their organization. And I don't see the email. I don't see the message right now in chat. It was a while ago.
As long as they do not take my name of the organization of the presentation, they
Right,
can use it.
you must give credit to
Yeah,
the
you must give credit
doctor for the
because
work.
it's because I worked for 2 or 3 days on this presentation, so it's my very hard. I worked very hard for this presentation, so you just don't take away the credits. You can use it. Any other question? If sir, you allow.
We're out of time
I
now.
hope they like. I'm writing the. It is very rewarding. Everyone is just like appreciating it. Everyone is just
Yes.
like appreciating it. So I have to thank them as well. Thank you everyone for the patience.
Yeah, so what we're going to do now is usually I stay after and answer questions about academic things, but I don't have time today. So we're going to have to end the
Okay, no
session right
problem at
now.
all.
I will be back
No
tomorrow to
problem
answer
at all.
questions. So I
Okay, no problem
truly
at
want to
all.
thank you, Dr. Omer
So
Farooq.
yeah, I just let me thank everyone as well. Just let me thank everyone as well. I hope I delivered what I wanted to deliver, because I worked so hard on this. And if management wants to pursue this, definitely we can go ahead with the second part of the presentation, because I just covered the basics of what is healthcare management. We have to understand the roles of a healthcare manager in details as well. If definitely somebody wants to learn it, if students want to learn it, they will know about their demands to the management.
I'm going to highly recommend you to coming back and doing more. You did a wonderful job. Your presentation was very informative.
Thank you, sir. Thank you, sir.
Organized.
That means a lot. That means a lot.
So what I'm going to do now is allow all the students to unmute their microphone so that they can say thank you to you.
Okay, no problem at all.
Okay, everybody, you can unmute your microphones to say thank you.
Right.
Thank you.
Thank
Thank you very much.
Thank you.
Thank you, sir.
Thank you so
That was
much.
such a wonderful
Thank
presentation.
you so much.
You have time to send an advice. Okay.
I will be in touch with you. Thank you so much.
That is very rewarding. That is very rewarding.
Thank you.
See you soon. See you soon. See you soon. If you want more,
Okay,
if you want to
Have a
learn
good day.
more,
Have a
if you
good
want
day.
to learn more.
Excellent. Okay, everybody, we're going to end the session now. We'll see you
Okay.
again tomorrow for the next one.
Thank you so much, Dr. Lambert. Thank you so much, Dr.
Goodbye.
Lambert. Thank you so much.
Thank
Dr.
you so
Lambert.
much, Dr. Omer Farooq.
Goodbye.
Bye-bye, everybody.
Thank
We're
you.
ending the meeting now.
Bye.